CEN Written Exams General. Question 1. A patient with SVT has failed vagal maneuvers. The CEN should prepare to administer. Option A, adenosine 6 mg 4 push. Option B, atropine 1 mg 4. Option C, epinephrine 1 mg 4. Option D, amiodarone 300 mg 4. The correct answer is option A. Adenosine 6 mg 4 push. Adenosine is first line for stable SVT. It is given as a rapid 4 push, 1 to 2 seconds, followed by a 20 ml saline flush. Atropine is for bradycardia. Epinephrine is for cardiac arrest. Amiodarone is for ventricular arrhythmias. Adenosine works by transiently blocking AV node conduction. Question 2. A patient with pulmonary embolism has a Wells score of 6. What is the most appropriate diagnostic test? Option A, D-dimer. Option B, CT pulmonary angiography, CTA. Option C, V/Q scan. Option D, chest X-ray. The correct answer is option B. CT pulmonary angiography, CTA. In patients with a high pre-test probability for PE, Wells score 4, CTA is the diagnostic test of choice due to its high sensitivity and specificity. D-dimer is useful in low probability patients to rule out PE but has low specificity. V/Q scan may be used if CTA is contraindicated, e.g., renal failure. Chest X-ray may show other causes but is not diagnostic for PE. Question 3. A patient presents with a snakebite on the hand. Which intervention is appropriate? Option A, apply a tourniquet. Option B, suction the wound. Option C, apply a splint and elevate the extremity. Option D, administer antivenom. The correct answer is option D. Administer antivenom. Antivenom is the definitive treatment for snake envenomation. A tourniquet and suction are not recommended, they can cause tissue damage. Splinting and elevation are supportive but are not the primary treatment. Antivenom must be given as soon as possible, with monitoring for anaphylaxis. Question 4. A patient with a psychiatric emergency is being discharged. The CEN should: Option A, provide a written crisis plan and resources. Option B, schedule a follow-up appointment. Option C, ensure the patient has a safe discharge plan. Option D, all of the above. The correct answer is option D, all of the above. Psychiatric discharge planning is an essential part of emergency nursing care. It includes providing a written crisis plan, referral to community resources, scheduling follow-up appointments, and ensuring a safe home environment. This is part of the professional issues domain, covering discharge planning, patient safety, and continuity of care. Question 5. A patient with an amputation of the finger is brought to the ED. The amputated part should be: Option A, placed directly on ice. Option B, wrapped in moist gauze and placed in a sealed bag, then on ice. Option C, placed in a dry bag. Option D, discarded. The correct answer is option B. Wrapped in moist gauze and placed in a sealed bag, then on ice. The amputated part should be wrapped in moist gauze, placed in a sealed plastic bag, or container, and then placed on ice, not directly on the ice. This preserves the tissue for potential reimplantation while preventing thermal injury from direct ice contact. The CEN should ensure rapid transport with the patient and the amputated part. Question 6. A patient with status epilepticus has received lorazepam 4 mg 4 without cessation of seizure activity. The CEN should anticipate which next medication? Option A, phenytoin 20 mg/kg4. Option B, propofol 20 mg/kg4. Option C, valproic acid 20 mg/kg4. Option D, levetiracetam, Keppra, 1 gram 4. The correct answer is option A. Phenytoin 20 mg/kg4. After benzodiazepines, lorazepam, second-line agents include phenytoin, 20 mg/kg4, or fosphenytoin. Levetiracetam and valproic acid are also options but may be considered after phenytoin. Propofol is used for refractory status epilepticus. Airway management is critical, the patient may require intubation. Question 7. A patient with adrenal crisis, Addisonian crisis, presents with hypotension, hyponatremia, hyperkalemia, and nausea. The CEN should anticipate: Option A 4-hydrocortisone. Option B 4-normal saline. Option C 4-dextrose. Option D, all of the above. The correct answer is option D, all of the above. Adrenal crisis is a medical emergency requiring 4-hydrocortisone, 4-normal saline, 4-hypotension, and 4-dextrose if hypoglycemic. Signs include hypotension refractory to fluids, nausea, vomiting, hyponatremia, hyperkalemia, and hypoglycemia. Prompt treatment prevents circulatory collapse. Hydrocortisone should be given before the patient is transferred to the ICU. Question 8. A patient presents with a peritonsillar abscess with a hot potato voice, trismus, and drooling. What is the priority? Option A 4 antibiotics. Option B and consult for possible incision and drainage. Option C steroids. Option D CT scan of the neck. The correct answer is option B, and consult for possible incision and drainage. A peritonsillar abscess presents with a muffled hot potato voice, trismus, difficulty opening the mouth, drooling, and a unilateral bulging tonsil. It requires prompt evaluation for possible incision and drainage, IND, or needle aspiration. 4 antibiotics and steroids are adjuncts. Airway compromise is a risk, so airway management is the priority. A CT scan may be done to confirm the diagnosis but should not delay end consultation. Question 9. A patient with a long bone fracture presents with severe pain out of proportion to the injury, swelling, and pallor. The patient has a cast. Which diagnosis should the CEN suspect? Option A compartment syndrome. Option B fat embolism. Option C osteomyelitis. Option D DVT. The correct answer is option A, compartment syndrome. Compartment syndrome is a surgical emergency characterized by pain out of proportion to the injury, pallor, pulselessness, paresthesia, and paralysis. The 6 Ps: pain, pallor, pulselessness, paresthesia, paralysis, poikilothermia. It occurs when pressure within the compartment exceeds perfusion pressure, leading to ischemia and necrosis. Immediate fasciotomy is required to prevent irreversible damage. Question 10. A patient presents with chest pain, shortness of breath, and pleuritic pain. Vital signs: HR 110, RR 24, SpO2 88% on room air. The patient recently had knee surgery. Which diagnosis is most likely? Option A myocardial infarction. Option B pulmonary embolism. Option C pneumothorax. Option D pericarditis. The correct answer is option B, pulmonary embolism. This patient has risk factors for VTE, recent surgery, immobility, and presents with the classic triad of dyspnea, chest pain, and hypoxia. Pulmonary embolism, PE, should be suspected. Wells criteria and PERC rule can help stratify risk. CTA is the diagnostic test of choice. Anticoagulation should be initiated promptly if PE is confirmed or strongly suspected. Question 11. What is the primary mechanism of injury in a patient with a flail chest? Option A penetrating trauma to the chest. Option B blunt trauma with fractures of 3 or more adjacent ribs in at least 2 places. Option C sudden deceleration injury. Option D compression injury causing rupture of the diaphragm. The correct answer is option B, Blunt trauma with fractures of 3 or more adjacent ribs in at least 2 places. Flail chest occurs when 3 or more adjacent ribs are fractured in 2 or more places, creating a freely mobile segment. This paradoxical movement impairs ventilation and may lead to respiratory failure. The underlying pulmonary contusion is often the main cause of hypoxia. Treatment includes pain control, oxygen, and possible mechanical ventilation. Question 12. Which medication is indicated for status epilepticus as a first-line agent? Option A lorazepam, Ativan, 4 mg 4. Option B fosphenytoin 20 mg/kg 4. Option C levetiracetam, Keppra, 1 gram 4. Option D valproic acid 20 mg/kg 4. The correct answer is option A. Lorazepam, Ativan, 4 mg 4. Benzodiazepines are the first-line treatment for status epilepticus. Lorazepam 4 mg 4, or diazepam 10 mg 4, is the preferred agent. If the seizure continues, second-line agents include fosphenytoin, valproic acid, or levetiracetam. Airway management and ABCs are priorities. Early treatment reduces morbidity and mortality. Question 13. A patient with organophosphate poisoning presents with excessive salivation, bronchuria, and muscle fasciculations. The CEN should anticipate. Option A atropine and pralidoxime, 2 pam. Option B naloxone. Option C flumazenol. Option D activated charcoal. The correct answer is option A. Atropine and pralidoxime, 2 pam. Organophosphate poisoning, e.g., from pesticides, causes cholinergic crisis, sludge, salivation, lacrimation, urination, diaphoresis, GI distress, emesis. Treatment includes atropine, to block muscarinic effects, and pralidoxime, 2 pam, to regenerate acetylcholinesterase. Decontamination is also essential, remove clothing, wash skin. Naloxone is for opioid overdose, flumazenol for benzodiazepines. Question 14. A patient presents with a fracture of the tibia and fibula after a motor vehicle accident. The patient has a palpable pedal pulse and sensation. What is the initial action? Option A reduce the fracture. Option B apply a splint to immobilize. Option C apply a tourniquet. Option D perform a neurovascular assessment. The correct answer is option D. Perform a neurovascular assessment. The first step in any fracture assessment is a neurovascular assessment: pulses, sensation, movement, color, temperature. Even if the pulses are palpable, the CEN should document the baseline to monitor for changes. Splinting is important to prevent further injury, but neurovascular assessment comes first. Tourniquet is for bleeding control, not for fractures. Question 15. A patient with ARDS requires mechanical ventilation. The CEN should anticipate which ventilator strategy? Option A tidal volume of 10 to 12 ml/kg of ideal body weight. Option B low tidal volume, 6 ml/kg, and plateau pressure 30 cm H2O. Option C high PEEP and low FiO2. Option D pressure support ventilation only. The correct answer is option B. Low tidal volume, 6 ml/kg, and plateau pressure 30 cm H2O. ARDS, acute respiratory distress syndrome, is managed with lung protective ventilation, low tidal volume, 6 ml/kg of ideal body weight, and plateau pressure 30 cm H2O to prevent ventilator-induced lung injury. PEEP is adjusted to optimize oxygenation. Higher tidal volumes are associated with lung injury. Pressure support is not typically used for severe ARDS. Question 16. A patient with a chemical burn to the skin should have the skin. Option A neutralized with an acid or base. Option B decontaminated with water. Option C covered with a sterile dressing. Option D, treated with a topical antibiotic. The correct answer is option B. Decontaminated with water. Chemical burns require immediate decontamination with water, irrigation, for at least 15 to 20 minutes. Neutralization is not recommended because it can cause exothermic reactions, heat, or further tissue damage. The CEN should remove contaminated clothing and irrigate the skin thoroughly. This may be done before the patient arrives in the ED, pre-hospital. Question 17. A patient presents with anxiety, palpitations, and a feeling of impending doom. Vital signs: HR 110, BP 140/90, RR 22. The patient reports a stressful event. The CEN should: Option A, rule out medical causes, ACS, PE, hyperthyroidism, etc. Option B, administer a benzodiazepine. Option C, reassure the patient and send home. Option D, perform a psychiatric evaluation. The correct answer is option A. Rule out medical causes, ACS, PE, hyperthyroidism, etc. Many psychiatric symptoms, panic attacks, anxiety, hyperventilation, can mimic medical emergencies. The CEN must rule out medical causes like ACS, PE, hyperthyroidism, and thyrotoxicosis before treating the patient for anxiety or panic disorder. An ECG, labs, thyroid, glucose, and appropriate imaging should be considered. Once medical causes are ruled out, anxiolytics may be considered. Question 18. What is the initial fluid of choice for a patient with hypovolemic shock? Option A, lactated Ringer's solution. Option B, normal saline, 0.9% NaCl. Option C, dextrose 5% in water, D5W. Option D, blood products. The correct answer is option B. Normal saline, 0.9% NaCl. Normal saline, 0.9% NaCl, is the initial fluid of choice for hypovolemic shock, hemorrhage, trauma, etc. It is isotonic and rapidly expands intravascular volume. Lactated Ringer's is also acceptable but should be avoided in liver failure. D5W is not appropriate for volume resuscitation, it distributes into total body water. Blood products may be needed, but crystalloids are the first line. Question 19. Which finding is most concerning in a patient with acute abdominal pain, suggesting peritonitis? Option A, rebound tenderness and guarding. Option B, nausea and vomiting. Option C, diarrhea. Option D, fever. The correct answer is option A. Rebound tenderness and guarding. Rebound tenderness, pain upon release of pressure, and guarding, involuntary muscle stiffness, are signs of peritonitis, indicating peritoneal irritation. These are surgical red flags. Nausea, vomiting, diarrhea, and fever are nonspecific and can be seen with many abdominal conditions. CT imaging can help confirm the diagnosis: appendicitis, diverticulitis, perforation, or bowel obstruction. Question 20. A patient presents with sudden onset of right-sided weakness, facial droop, and aphasia. The last known well time was 3 hours ago. What is the priority action? Option A, obtain a stat CT head, non-contrast. Option B, administer aspirin 324 mg. Option C, start 4-alteplase, TPA. Option D, obtain an MRI. The correct answer is option A. Obtain a stat CT head, non-contrast. This patient is having an acute ischemic stroke. The priority is a stat non-contrast CT head to rule out hemorrhage before administering TPA. The time window for 4 TPA is within 4.5 hours of last known well. This patient is within the window. However, CT must be done first to rule out hemorrhagic stroke, which is a contraindication to TPA. Aspirin may be given after TPA is ruled out. Question 21. A patient is in respiratory distress with a heart rate of 120, respiratory rate of 36, and SpO2 of 85% on 4L/min nasal cannula. The patient is anxious and unable to speak in full sentences. What is the appropriate next step? Option A. Increase oxygen to 15 L/min via non-rebreather mask. Option B. Intubate immediately. Option C. Apply BiPAP. Option D. Administer bronchodilators. The correct answer is option A. Increase oxygen to 15 L/min via non-rebreather mask. This patient is in respiratory distress with hypoxia, SpO2 90%. The first step is to maximize oxygen delivery with a high-flow non-rebreather mask, 15 L/min. If the patient does not improve, non-invasive ventilation, BiPAP, or intubation may be needed. Bronchodilators are appropriate for bronchospasm but not the primary intervention in all cases. Intubation is considered if the patient fails non-invasive measures. Question 22. A patient with a suspected hemorrhagic fever, e.g., Ebola, should be managed with Option A. Strict contact and droplet precautions. Option B. Airborne precautions. Option C. Standard precautions. Option D. Enhanced contact and droplet precautions. The correct answer is option D. Enhanced contact and droplet precautions. Hemorrhagic fevers, Ebola, Marburg, Lassa, require a high level of isolation, enhanced contact and droplet precautions, including double gloves, impermeable gowns, face shields, and shoe covers. These patients should be in a single room with dedicated equipment. The CEN should follow the facility's protocol for high-consequence infectious diseases. Airborne precautions may also be used in some settings. Question 23. What is the Glasgow Coma Scale, GCS, score for a patient who opens eyes to pain, makes incomprehensible sounds, and has abnormal flexion, decorticate, posturing? Option A 10, E2V2M4. Option B 8, E2V2M3. Option C 7, E2V2M3. Option D 9, E3V2M4. The correct answer is option C. 7, E2V2M3. GCS assesses eye opening, E2 to pain, verbal response, V2 incomprehensible sounds, and motor response, M3 abnormal flexion/decorticate. 2 + 2 + 3 = 7. A GCS 8 generally indicates the need for airway management, intubation. GCS is used to monitor neurological status in patients with head injury or stroke. Question 24. A patient with acute cholecystitis presents with right upper quadrant pain, nausea, vomiting, and fever. Murphy's sign is positive. Which diagnostic test is preferred? Option A. Abdominal ultrasound. Option B. CT scan. Option C. HITA scan. Option D. X-ray. The correct answer is option A. Abdominal ultrasound. Ultrasound is the diagnostic test of choice for acute cholecystitis, showing gallstones, gallbladder wall thickening, and pericholecystic fluid. Murphy's sign, pain on deep inspiration while palpating the right upper quadrant, is a classic finding. Treatment involves NPO status, 4 fluids, antibiotics, broad spectrum, and cholecystectomy. CT may be used if complications are suspected. Question 25. A patient with a tracheostomy tube dislodges it. The CEN should. Option A. Call respiratory therapy. Option B. Reinsert the tracheostomy tube immediately. Option C. Cover the stoma and ventilate via bag mask over the mouth and nose. Option D. Suction the stoma and reinsert a smaller tube. The correct answer is option C. Cover the stoma and ventilate via bag mask over the mouth and nose. If a tracheostomy tube dislodges, the CEN should cover the stoma with a gloved hand and attempt to ventilate via bag mask over the mouth and nose. If ventilation is not effective, the stoma may be used for ventilation, with a smaller tube or tracheostomy obturator. Reinsertion should be attempted by trained staff. Blind attempts can create a false passage. Suction and airway support are priorities.